let's start the test. This is a recording for occupational English test held in AJINORAH institutions, Kochi. The candidate is Mary K. Paul and the candidate number is 2000244653. The interviewer is Vibin Wilson and the interlocutor's number is 641382. The role play numbers are 1 and 2. And the profession is nursing. Good afternoon, my name is Vibin Wilson. Can you say your name for the record purpose?
Good afternoon, my name is Mary K. Paul.
And what is your candidate number?
My candidate number is 2000244653.
Okay, thank you. And you are taking this test as a nurse, is that correct?
Yes.
Cool, thank you. Can I see your ID please?
Yes, sir.
Here you are.
Thank you.
That's great. So please confirm your details on the test paper, then read and sign the candidate declaration in this booklet.
Yes, sir.
Here is a booklet and here is your pen.
Thank you.
Thank you. So I am going to work with you for this test. There will be warm-up questions followed by a role play. Remember, this is a test of English, not of your professional knowledge. And please speak naturally. Do you have any questions?
No, sir.
Cool. The warm-up questions are not assessed, but it is a chance for us to get used to each other's voice. We will just talk for 2 to 3 minutes. Mary, how long have you been a nurse?
I graduated in 2019 and I have been working as a nurse for the past 2 years.
Okay, that sounds great. So with this experience, what is the very best next advice that you can give to an upcoming nurse?
I would like to advise my juniors regarding the time management, as it is very important to manage the time. We need to finish a lot of work.
Okay, that too sounds great. I appreciate that. So let's move on to the role play now. I will take the part of the patient or perhaps a relative, and you will take your professional role. The role play will last for about 5 minutes. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, sir.
Cool. You have up to 3 minutes to prepare the role play. You will start the role play after that time. I will let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want. Here is a pen.
Thank you, sir.
And here is a role play to prepare.
Okay, sir.
And your 3 minutes starts now.
Okay. How can you call it during this role play, sir?
You can address me as George.
Okay, thank you.
And you ran out of time. Your 3 minutes are up. Okay. And you can look at the card during the test, but you must return to me at the end of the test. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Yes, sir. So, Mr. George, thank you for allowing me to assess your thigh.
Okay.
Before proceeding further, shall I ask you some questions?
Why not? Go for it.
Okay. Firstly, have you taken any medication for this wound?
I have just taken a paracetamol to kill the pain. Other than that, I just, wrapped my wound with a bandage.
Thank you for the information, Mr. George.
Okay.
Secondly, have you taken any vaccine for this tetanus before?
I do remember taking the vaccine for tetanus when I was a child.
Okay.
Yeah.
I'm pretty good to hear that you had taken the vaccine and cared your wound well.
Okay.
So, Mr. George, your wound seems a little bit infected, so which may require some antibiotic. Is that okay with you?
You know, nurse, I was about to ask you for some antibiotics and you hit the nail on the head. Thank you.
Okay, Mr. George. And before consulting with the doctor, I can clean and dress the wound. Shall I proceed with that?
I don't think it is a bright idea. From your words, what I understand is that it is quite painful. So I'm not willing to.
Okay, Mr. George, there might be some pain, but it is okay. It is important to dress and clean the wound as soon as possible, because there might be some foreign particles which may cause further infection to your wound. If you have a lot of pain, means I can give you some local anesthetic. How does that sound, Mr. George?
Yep, it sounds better. I think I can oblige for it.
Okay, thank you, Mr. George.
You're welcome.
And I highly urge you to take the second dose of this tetanus vaccine now. Is that possible with you?
You know, it's like I already told you that I have taken when I was a child. So what is the necessity as of now for me to take the vaccine?
Okay, that's a reasonable query, Mr. George.
Yeah.
You know, for tetanus vaccines, there's only 6 months of effect. So it is important to take this vaccine right now again.
Okay, I do understand. Okay, I will take it.
Okay, thank you for your cooperation, Mr. George.
Cool.
And if you wouldn't mind, could you please come tomorrow for a follow-up visit?
Is it really necessary?
Yes.
Okay, if it is really necessary, I will make myself present here.
Okay, if you could do so, I can assess your wound progression, and if it deteriorates, means we can go for a surgical wound debridement.
Okay, can you tell me what was that towards the end?
Yeah, I'm really sorry, Mr. George. There's a wound, surgical wound debridement means we are removing the unhealthy tissues from your wound.
Okay, I understand. Okay, so I'll present myself tomorrow.
Okay, thank you, Mr. George.
You're welcome.
Thank you.
Cool. Here we come to the conclusion of your speaking test and you can take a leave. Thank you.
Okay, thank you, sir. ഈ റോൾ പ്ലേ ഒരു നോൺ കേസ് ആയിരുന്നു. കോൺവെർസേഷൻ്റെ മിഡിലിൽ നിന്നാണ് ഈ റോൾ പ്ലേ സ്റ്റാർട്ട് ചെയ്യുന്നത്. റോൾ പ്ലേയിൽ പേഷ്യൻ്റ് തൈയിൽ ഒരു മെറ്റൽ പീസും കൊണ്ടുണ്ടായ വൂണ്ടായിട്ടാണ് നമ്മുടെ അടുത്ത് വരുന്നത്. അപ്പം നമ്മൾ വൂണ്ട് ഡ്രസ്സിങ് ആൻഡ് ക്ലീനിങ് റിലേറ്റഡ് ആയിട്ടുള്ള കാര്യങ്ങളും അതുപോലെ തന്നെ ടെറ്റനസ് വാക്സിൻ്റെ കാര്യങ്ങളൊക്കെ പേഷ്യൻറ്റിനോട് പറയുന്നുണ്ട്. കൂടാതെ പേഷ്യൻ്റെ ക്വയറീസും കൺസേൺസ് ഒക്കെ നമ്മൾ ക്ലാരിഫൈ ചെയ്യുന്നുണ്ട്. ആൻഡ് ഫൈനലി പേഷ്യൻറ്റിനോട് നമ്മളൊരു ഫോളോ അപ്പ് വിസിറ്റ് റിക്വസ്റ്റ് ചെയ്യുകയാണ് വൂണ്ടിൻ്റെ പ്രോഗ്രസ് ഒക്കെ അറിയാൻ വേണ്ടിയിട്ട്. അപ്പം അത് ഡിറ്റീരിയോറേറ്റ് ചെയ്യുകയാണെന്നുണ്ടെങ്കിൽ നമുക്ക് സർജിക്കൽ ഇൻ്റർവെൻഷൻ വേണ്ടി വരും നമ്മൾ പേഷ്യൻറ്റിനോട് ഇൻഫോം ചെയ്യുന്നുണ്ട്. അപ്പോൾ പേഷ്യൻറ്റ് ചോദിക്കുന്നുണ്ട് സർജിക്കൽ ഇൻ്റർവെൻഷൻ എന്താണെന്ന്. അപ്പം നമ്മളത് ഡീറ്റെയിൽഡ് ആയിട്ട് പറഞ്ഞു കൊടുക്കുന്നുണ്ട്. അങ്ങനെയാണ് ഈ റോൾ പ്ലേ എൻഡപ്പ് ആവുന്നത്. ഇതിൽ എല്ലാ സ്പീക്കിംഗ് ക്രൈറ്റീരിയയും മെറ്റ് ചെയ്തിട്ടുണ്ട്. നഴ്സ് ത്രൂ ഔട്ട് ദിസ് റോൾ പ്ലേ എംപതറ്റിക് ആയിരുന്നു. അതുപോലെ ഇൻഫർമേഷൻ ഗ്യാതറിംഗ് ഉണ്ടായിരുന്നു, ഇൻഫർമേഷൻ ഗിവിംഗ് ഉണ്ടായിരുന്നു. ഇതൊരു നല്ല റോൾ പ്ലേ ആയിരുന്നു. ഈ വീഡിയോ എല്ലാവർക്കും യൂസ്ഫുൾ ആണെന്ന് വിചാരിക്കുന്നു. താങ്ക് യു ഫോർ വാച്ചിങ്.